Hello everyone, my name is Tara Petty and I am in the RN to BSN program at Grayson County College. And for my community health project, I chose how do we stop teenagers from vaping. So I know this is a very serious issue for our country and especially for our teenagers, so I just wanted to try to come up with a community health project to help deter them from vaping. Now my target population is the high school students at Howell, Texas. So Howell is located in Grayson County. It was established in 1884. It has a population of around 3,500 people and is predominantly English with 23 Hispanic and 4% African American. Now the population that I will be focusing on is the 14 to 18-year-olds that attend Howell High School. Howell High School is a relatively small community. They only have about 436 students that are enrolled in the high school. And here's a picture of the school and the welcome sign from our town. So we're going to go and look at how we can deter these students from smoking. Now during my windshield survey, I did drive around town, took several pictures of some of the places that we have in town. So the positives that we have for Howell, Texas is we are a very growing community. Statistically, when I went to the last city council meeting, they said that they're expecting Howell to triple in the next 10 years. So there's going to be a huge amount of growth going on in this area. So this area also has a very active and involved population. Any sort of sporting event or football games or downtown parades that they have, there's always a lot of people that are there. And it has many churches, and we do have a senior center downtown as well. Now some negatives, Howell is a very small community, and with that you only have one medical office, and that's a dentist that's in town. So if the employees or if the students need to go for any sort of medical care, then they do have to drive into Sherman or on into Denison to get that medical care. We also have a large population of non-English speaking residents, which will come into play when I'm trying to do my education for my project. And there's currently no vaping or smoking education program that is at the high school, so that's a negative as well. And I did drive by the two gas stations that are in town, and both of them had many signs and advertisements up for smoking and vaping products. So just some Grayson County statistics. I couldn't find Howell specific statistics, but for the county of Grayson, our statistics for lung cancer are a little bit higher than the Texas average. For stroke, we're quite even with what Texas is. And then for heart disease at 183.4, we are quite a bit higher than what the Texas average is for those. So some statistics about vaping. It's most common that they would use e-cigarettes. I think that's really because, they don't have the smell that the normal cigarettes do, so they can kind of get away with it. So that's kind of an interesting thing with the vapes that have come out. It is estimated that 1.6 million teenagers in our country are addicted to e-cigarettes, and that is a staggering statistic to me. So nicotine is very addictive, and it can cause harm to the developing brain, which is something that we have with the teenage students. So they really kind of vape because there's advertising everywhere about them. Social influences, they see videos on TikTok, they see things on music videos, and so they know that it's there, and they're pushed towards vaping. And then they have just the different flavors and the addiction to the nicotine. So inhaled nicotine affects nearly every organ in the body, especially the lungs and the brain. And then cigarette smoking and vaping can lead to serious preventable deaths all across our country. So for my community nursing problem, my nursing diagnosis was just the lack of education surrounding the dangers of vapes and nicotine consumption. And then students are addicted to nicotine, and they may find it harder to quit and modify their lifestyle and get out of that unhealthy behavior that they have. So the needs are that the children ages 14 to 18, which is my targeted population, really need facts and education surrounding nicotine addiction. And then given the age of our focus population, they're not really able to make decisions like that on their own, but somehow they're getting these vapes illegally. So my goal for my community project, the goal would be to decrease the number of students at Howell High School that actually smoke or have any sort of nicotine consumption. And by educating the students, I would hope that we would, take down the risk of them having any health benefits, and help them be successful at quitting. I found on the cdc.gov website that they have an Empower Vape-Free Youth program. It's an entire program that can be used, and it specifically encourages high school educators to teach their students about the vapes and the dangers of them. So my plan for my community project is education. That's going to be the first thing that we're going to focus on. We need it to be school-wide. We need it to be where it can reach every student that's there, so it's going to need to be in multiple languages perhaps, and then also individual. So we would kind of put the burden on the health of the nurse, the school nurse, or the counselor that's there, but if they needed one-on-one education or individual talking about their vaping habit or their addiction, that they could come and they could get that from an educator that's there. We would also need policy changes and updates, so working with administration to come up with a policy, because currently there is not one. I did interview some of the staff. I interviewed the school nurse at the school and one of the vice principals, and both of them said that there's currently not any policies that go with it. Now, it is in the student's handbook, and they do have to sign that they agree with it and they have read it and understand it, but there's not any policies around vaping or smoking education. So we also toured the school, and there's not any posters in the hallway about vaping or resources for helping to quit vaping. So I would definitely want to work on that. And then just sending flyers home to students and their parents, because I know a lot of them, their parents also vape and smoke, so that's encouraging them, or that's something that they see every day, and so there's no incentive to not do it. So education going home to parents and students would be a big focus for this project as well. So, and then having a school-wide assembly. I asked when I interviewed, and they said they do not have any school-wide assemblies with education over nicotine or vaping. So, perhaps having where we can get all of the students together so we can focus on education for them about this would be great. And then possibly one of my thoughts was bringing in a real-life person to do a talk with the students who has suffered some sort of bad health or some sort of issue with vaping, just so that they could hear it from a person firsthand, and then I can actually put a face to name and know this is not just something that people are trying to talk about. This is actually real. So I did get some statistics here. Studies show that close to 90% of adult smokers started smoking before the age of 18. And that is a staggering statistic. If we're going to keep the adults from smoking, chances are we're going to need to catch them when they're at a high school age or below. So implementing my program. So the first thing would be education. I would need to arrange with school officials to pass out education at the schools to make sure that it goes home in English and Spanish if needed. To work with the school to arrange for an outside speaker to come in, or to do some sort of assembly-wide all-school assembly, and then just print posters. On the cdc.gov website, they have several different videos that can be used. They have posters that can be hung up. They're all free. They have education for educators so that they can understand it and know how to teach their students. There's lots of resources on there, so that would definitely be part of implementing the project. So like I said here in the yellow box, the CDC has videos that they can use. They have resources for healthcare providers such as nurses or school nurses to help teach students. They also have for educators so that they will know how to speak to the students about it, and then also for communities and things like that. So the barriers to my implementation would be perhaps the resources would not be approved for me to be able to print large posters or print, 500 sheets that can be taken home in both English and Spanish. So that would be, something that might hinder the program being implemented. And also just the long-term upkeep, because it would need someone that would be willing to take it over and do this year after year after year, because you're going to have new students that are coming into the district and coming into the high school that are going to need this education as well. And then just poor reception by the students, or maybe the educators as well. Poor reception by the caregivers or the parents when we send them home, just looking at it and tossing it in the trash and not actually reading it and getting that education from the posters or the literature that we hand out. So to evaluate the successfulness of the project, This one I kind of struggle with because I do know that it's going to be a little difficult to evaluate this project. So the best things that I could come up with was maybe we could do surveys or questionnaires that are filled out by the students after they've had the education, just to review their knowledge and make sure, did they get it? Are they understanding the risk and the harmful things that can happen to their bodies? Maybe doing just, you know, a one-on-one survey with them or a one-on-one questionnaire so that they could ask questions if they didn't understand something. And then just individual interviews. So just sit down with some students and kind of select a random selection of students and just say, you know, how do you think the education went? Do you think it would be something that we can improve upon? What suggestions do you have? Do the videos work better? Do the handouts work better? And just kind of evaluate that with them so we can make modifications and changes to the project in the future so that we can best reach these students. So here are my resources for my community project plan. I did get some information off the city directory for Howell, Texas, the cdc.gov, both a couple of different sites that we have on there, and these are really good resources that, I mean, they've got a ton of stuff and games and videos and things that you can get out to students to help try to teach them about the dangers of vaping. And then also there was an article that I looked at, and so those are the references. All right, and thank you for watching. I appreciate everyone for watching and your feedback. Thank you.